Okay, so the idea now is to talk about Pilocystic astrocytoma. It is also called, because it's more commonly in young patients, like pediatric patients, it's also called juvenile Pilocystic astrocytoma. It can be in some places and mostly in the cerebellum, and when it is related to neurofibromatosis type 1, it can be in the optic chiasm more commonly. It's defined as grade 1 tumors by the WHO classification, and we will see the presentation of these tumors. It's usually cystic with enhancing mural nodules. So in T1 weighted imaging, MRI, you can see mostly in the cerebellum, because it's mostly in the cerebellum, a cystic lesion with enhancing mural nodule, and don't mistake it with a Hemangioblastoma, which also can be cystic with enhancing mural nodule. Hemangioblastomas are more vascular lesions, so sometimes you may see flow voids, which may help you differentiate hemangioblastomas from this tumor, from this Pilocystic astrocytoma. So let's look at some imaging and you will see the finding that I'm talking about. So you can see it's quite giant here. It of course compress the structures around it, but these tumors you can see here, it's on T2 MRI, and what you can see is a cystic lesion. It's hyperintense on T2 with a more hypointense or isointense mural nodule. On T1 weighted imaging with gadolinium, as you can see here, you see more like a hypointense lesion with enhanced mural nodule. This is on T1 weighted imaging. This is another one. Not sure. Okay, again, T1 weighted imaging with gadolinium. You see cystic lesion with enhancing mural nodule in the posterior fossa, in the cerebellum. Here again, this one is not T1. This is more like a T2 weighted imaging. So you get the point. T1 with gadolinium is one of the most useful sequences, but also T2. You can see here some T1. I think this is without gadolinium, it's not very good. But this is the idea of Pilocystic astrocytoma, usually pediatric patients. Cerebellum, it may be associated with NF1, and then it's in the optic chiasm, sometimes another place. And that's it about Pilocystic astrocytoma. Thank you, JPA.